In this video we will look at important investigations for pulmonary embolism. Pulmonary embolism is a condition in which a dislodged thrombus obstructs the pulmonary vessels. We have already covered the etiology and clinical features. Now let's see how to investigate if we suspect pulmonary embolism. If we suspect pulmonary embolism, we have to apply modified Wells criteria. In this criteria we assign score. Score is on the basis of presence or absence of certain features and factors. Let's memorize it with the mnemonic modified. M is for malignancy. If suspect of pulmonary embolism has malignancy with ongoing treatment for past 6 months or is under palliative care, we will add 1 score. O is for other diagnosis. If patient does not have any other alternative diagnosis like acute severe asthma, acute exacerbation of COPD, or bronchiectasis, we assign 3 points. D is for DVT. If clinical features of deep venous thrombosis are present, additional 3 points are added. I is for increase in heart rate, that is tachycardia, presence of which is given 1.5 score. F. Now let's skip F. I. This I is for immobilization. If patient is immobilized for past 3 or more days or has undergone any surgery in last 4 weeks, we add 1.5 score. E is for expectoration. Presence of bloody expectorate or hemoptysis gets us 1 point. D. This D is again DVT. If patient has previous history of DVT or pulmonary embolism, we add 1.5 score. So first step in investigating pulmonary embolism is applying modified Wells criteria. If the total score of patient is more than 4, that pulmonary embolism is most likely. We will go for CT pulmonary angiography, which is gold standard for this disease. If results come back to be positive, patient has pulmonary embolism. If score of criteria is 4 or less, pulmonary embolism is unlikely, but we have to check the D-dimer assay to exclude the condition. If D-dimer level is 500 or less than 500 nanogram per meter length, pulmonary embolism is excluded. But if D-dimer is more than 500 nanogram per meter length, then we will do the confirmatory CT pulmonary angiography. That will decide the presence or absence of the disease. On a side note, if patient has contrast allergy or if patient has renal impairment, CT pulmonary angiography with contrast is contraindicated because the dye used in this procedure is nephrotoxic. That is all for today. Thanks for watching.